Welcome to Keiser Voices, the story of success, brought to you by Keiser University Graduate School, here where the academic world meets personal triumph. Join us today as we dive into the captivating tales of success.
Welcome back, everybody, to another episode of Keiser Voices, and we're here with two very special guests with a bonus episode for you all as we look to celebrate Pinktober while raising awareness for breast cancer. So we're excited to have two fabulous members of our graduate school faculty from the Women's Health Nurse Practitioner program join us. You all are familiar with Dr. Lawren Mundy, who has been a guest with us before. Dr. Mundy, we're so excited to have you back.
Thank you.
And joining us is Sara Boufakhreddine, who is also a member of our faculty of the Women's Health Nurse Practitioner program. Dr. B, thank you for joining us.
Thank you, Heather. I'm excited to be here.
So we want to help really carry a conversation about breast cancer. There's a lot of things that I think most people don't realize, and I'm going to, talk about the elephant in the room. Men can get breast cancer too. And it's not as prominent as women, but it's a reality. And I think at this point, all of us can name somebody that we know. We don't need to go 7 degrees of Kevin Bacon. I think within 1 degree, all of us can name somebody that we know in our lives who has had breast cancer. For me, it was my grandmother. It was operable. They caught it very early on. I mean, she had surgery and didn't tell anybody in the family. That's how quick and over and done with it was, and we were fortunate for that. But that's not the case for everybody. So, Dr. Mundy, what are some key facts we should know about breast cancer, including for men?
Well, for certain, like you mentioned, family history, and everybody thinks that family history is like the number one factor and risk factor for getting breast cancer, but actually it's not. It's age, it can be your diet, it's a part of it. I think family history comes in, I think, in third. But the biggest thing is making sure that you get your screenings done, making sure that I still encourage my patients to do breast exams, because especially that sometimes your patients won't come in every year to see you. They're the ones that are checking themselves, right? So make sure that you're comfortable with your bodies, make sure you're getting your screenings done. If you have any concern about anything, make sure that you see your healthcare provider to get some type of imaging done. And don't just assume that because you're young, or the case may be, that it won't, impact you in any way.
Dr. B, when we start talking about the signs and symptoms, what are things that people should not ignore, that they should call their healthcare provider about right away?
Yes. So we like educating patients on this idea of breast self-awareness and just being in tune with your body and the changes that might come up. And so a lot of people, which kind of ties into a little bit of myth, think that the only a sign or symptom that can present is a breast lump. And although we know that's a common sign or symptom, it's not the only thing. And we can still identify issues even in the absence of a lump. So some of the things we want them to be aware of and not ignore is if they're having any nipple discharge, especially if it's bloody, or unrelated to breastfeeding. Also, if they're having any skin changes, so like skin dimpling or puckering, any skin thickening, if they're having redness or warmth over the breast, if they're having something called peau d'orange, which is an orange peel-like texture of the skin, any changes in the breast size or the shape, and also anything that's unilateral. So if it's only on one side and it's not showing up on both sides, that's another thing you don't want to ignore. Of course, we have normal breast changes and tenderness during parts of the menstrual cycle, and we might see that on both sides. We might have some tenderness or soreness, but if it's one-sided, that's something you don't want to ignore. Also, any nipple retraction or inversion. Some people naturally have inverted nipples, but if that's something new for you, again, the new change, anything that's unusual for your norm would be something you wouldn't want to ignore. So I'd say those are the main things.
You mentioned myths, and if you don't mind, I do want to kind of ask a question about that. And I have one that I've heard about before, and I honestly, I couldn't tell you if it's true or not, but they say if you get pains on like one side compared to another, like random shooting pains, that it could also be a symptom. Is that true?
Well, I mean, I would say just in general, anything that's unilateral would be something you wouldn't want to ignore. Shooting pains could be even nerve related. It's not necessarily that it could be coming from somewhere else. So I don't know. I think it would require like a little bit more, potentially more information. But I would say if you're having any one-sided pain that's persistent and it's really starting to be bothersome, I wouldn't ignore. But yeah, as far as myths, definitely I would say the biggest one that I tend to see in practice is that people think that you need to have a lump in order for it to be suspicious for some kind of breast cancer related concern. And there are definitely symptoms that can pop up in the absence of a lump that are still concerning.
So, Dr. Mundy, when we're talking about the self-care that you and Dr. B both touched on, what practical tips would you recommend for our listeners for staying self-aware and even performing effective self-exams?
Well, for certain, like I mentioned, making sure that you're getting your screenings done. When you're doing breast exams, though, if you're still getting your menstrual cycle and it's regular, we usually recommend that you do your breast exams like a few days after your period finishes, because in that way that you have less impact of hormonal changes going on at that time. So that is why we tell you to do that. Also, in regards to performing a self-breast exam, if you don't feel like you're comfortable doing it, make sure your healthcare provider can teach you how to do it. But we usually recommend either laying down in the shower, laying down in the bed or standing up in the shower, and it's opposite hand to breast is what I usually teach my patients, and using two fingers, the pads of the fingers, as they're usually the most sensitive and can pick up on different changes going on in the breast. And then for patients that maybe don't get their period because they're on birth control continuously or postmenopausal, then I'll tell them like maybe use like your birth date of each month. So say you're born on the 21st of say January, so the 21st of each month, that kind of gives you a routine schedule to do your breast exam in the same fashion that I mentioned before, to do it once a month.
Would men check themselves the same way?
They typically do not. Like you mentioned before when we first started, it's not as common for men to get breast cancer. But I think especially if you know that you're at risk, meaning like family history or the case may be, then I would encourage them to also do their breast exams as well. And then also when they go in to see their primary care doctor, for them to perform a breast exam on them as well.
When we look at our habits and healthy lifestyles, and that's, I think even when we have the exercise and sports science program, we talk about healthy lifestyles. What can we do to help reduce risk and promote overall health?
I can answer that one if you'd like, Heather. I would say that there are things like we like to kind of identify in healthcare. There are modifiable risk factors and non-modifiable. And certain things like genetics, of course, are non-modifiable. But we know that there are certain things we can do within our control. And that would include things like just having a healthy lifestyle. So trying to be as physically active as you can, whatever that looks like for you. If it doesn't look like going to the gym, that's okay. Maybe it just means you go for a walk every day, or you go to the park with your kids or your family, whatever that looks like, just kind of maintaining that physical activity routine, maintaining a healthy body weight, and limiting any substances if possible. So limiting alcohol, limiting any tobacco products, using those products really carefully and cautiously, just because they do increase the risk for certain just chronic illness and cancer, as well as, if possible, for those who do become pregnant and are able to breastfeed. Breastfeeding does reduce risk as well. And then minimizing exposure to any radiation also can help with reducing risk as well.
I want to kind of move back to talking about, like, this has been great information. I think everybody, very helpful for them. I want to move back to talk about, in general, about Breast Cancer Awareness Month. There are 4 different types of breast cancer. So I've done a little bit of homework. Let's see if you guys are going to give me passing grades. We have inflammatory breast cancer, hereditary, or can we also know that my biology is not my subject? Hereditary or genealogical cancer. There's male breast cancer and metastatic cancer. I know I pronounced some of those wrong, so you guys can go ahead and correct me. 1 in 8 women in the U.S. are diagnosed, according to the National Breast Cancer Foundation, a year. Men, it's 1 in, I can't remember if it's 833 or 863. It's a high number, like you guys said. It's not as common, but it happens. And then for the clarification on metastatic breast cancer, that's stage 4 breast cancer. Is that the most common, the stage 4, or is there one that's more common than others that's going to come up more in conversation?
I don't think that stage 4 is the most common. I would say probably like your inflammatory were probably the most common out of the 4 that you just discussed. And maybe even that gynecological, the hereditary, maybe up there with that one too as well. But definitely not the metastatic, and definitely not the male breast cancer, if you had to divide them into categories.
When we look at Breast Cancer Awareness Month, we go pink in October. We're doing a whole podcast episode to talk about it. Why is it important, Dr. Mundy, to continue to raise awareness and have these conversations?
I think so even though it's become better, and when it's caught early, sometimes your patients don't even need chemo radiation. It's just about removing the lump and frequent screenings, frequent, visits with oncology and so forth. But especially for our patients who don't have access, and I'll bring up, Black women, they are at less risk for getting breast cancer as compared to white women, but they're more likely to pass away from the disease and anything else. And that just goes back to saying decrease access to screening. Some people, if they don't have any pain, will not go to doctor for anything. And as we discussed before too, you don't have to have pain to have breast cancer, right? So I think because they're not having anything, they think that, everything's fine, everything looks fine, so forth, and they don't go. But that is why we need to continue to bring awareness, right? How we eat. Dr. Boufakhreddine mentioned, exercising. Even if you can't make it to a gym, if you can just walk, anything to help to decrease the risk, and being aware of it. We also mentioned too, all of our families don't tell us what happened in our family history. They think it's best for them not to share that information, which can come back to not help all of us. But making that awareness is important. That even though if you don't know your family history, maybe you've been adopted and you don't know that, it's so important for you to make sure that you get your screenings done, to do your breast exams, to make sure that you're good.
Before we let you guys go for the day, and we're so grateful for you joining us on this special episode, what final message would you both like to leave for those who are listening to encourage them to take action, in caring for their health? And I'm going to pick on Dr. B first.
Yes. Thank you, Heather. This is great. I think this is such an important topic. As you said, there's a lot of people being impacted by this, and we need to have more conversation around it. I would say the biggest thing is just knowing your body. No one is going to know your body better than you. And no one's going to be able to identify those changes as well as you, even your provider. Your provider will, of course, be able to educate you and guide you and do those physical exams for you. But you're the one with your body every single day. So don't ignore any change that comes up. Don't gaslight yourself and tell yourself it's normal. Maybe I'm fine. It's just always better to be safe. Don't skip your mammograms. Try to go to your mammograms on time when they're due. And remembering that it's just like Dr. Mundy said, it's not always genetic. It's a lot of it is actually not genetic, is what we have found. So there's evidence of lifestyle-based things that we can do to prevent, and just try to be as healthy as possible. And it's easier said than done, but I think that just implementing slowly, starting with what's realistic, for you and your lifestyle is the best place to start.
Dr. Mundy, some last messages for our audience?
I actually agree with Dr. B too as well. Definitely not to skip out on any of your mammograms or breast ultrasounds or even breast MRIs. We didn't bring that up, but a strong family history of breast cancer, you can get a breast MRI done every year just because at your increased risk. But definitely don't skip out on any of your screenings that you're supposed to have done. Eating, a nice, balanced, healthy lifestyle and exercising. I think those are the key things that all of us as women and even men, if you are at risk, should be following.
Amazing. Thank you both for taking the time to come on and join us and help us raise awareness. We appreciate you both so much.
Thank you for inviting us. Appreciate it.
Thank you.
And if you guys have enjoyed this conversation, be sure to like, share, subscribe, and follow us here at Keiser Voices. Additionally, for breast cancer awareness, we're going to include some very helpful links here in the comments below, so check them out. There'll be some additional resources that we're going to get from Dr. Mundy and Dr. B that would be very valuable to the audience to help you have those conversations with your regular physicians. So thank you all for tuning in, and we will catch you on the next one.
Thank you for journeying with us today on Keiser Voices, the story of success. As we close this chapter, remember, every story has its next page.